Hi friends, welcome to classes by Lab Doctor. In today's class, let us understand how much of sunlight do we need to get adequate amount of vitamin D. You all know that when the sun rays will fall on our skin, when the UVB is exposed to our skin, the 7-dehydrocholesterol which is present in our skin gets converted into vitamin D3, that is cholecalciferol. Okay, so this vitamin D3 or cholecalciferol, the first process of this 7-dehydrocholesterol getting converted into vitamin D3 begins in the skin. So this is a very important process. Just by looking at the sun, you will not get sunlight. The sunlight has to fall on your skin, and the underneath the skin, the fat which is present, when the sun rays, the UVB rays, when it falls on that, that is when this process of formation of this vitamin D starts. So sun exposure, the skin being exposed to sunlight falling on your skin becomes very important. If you are covered completely, if you are wearing a full length shirts or trousers completely covered, you will not get vitamin D no matter how much time you stand in the sun. So the process is that this sunlight has to fall on the skin, and then this process of formation of vitamin D will start. This vitamin D3 is carried by our blood into the liver, where it is getting converted into calcidiol, and then in the kidneys it gets converted into calcitriol. And this calcitriol is an active form, and this helps in the maintaining the calcium metabolism in the body. So may it be through the bone health, or through absorption of calcium from the intestine, or prevention of excretion of calcium from the kidneys, it will maintain the calcium levels in the blood. So vitamin D, we talk about vitamin D so much because vitamin D has so many roles. Each cell in our body needs vitamin D. May it be for muscle calcium, for bone mineralization, regulation of immune function, regulation of phosphorus and calcium homeostasis, regulation of insulin secretion, and stimulation of cell differentiation. All these will require vitamin D. But there are few factors which affect the vitamin D absorption. One is the sun exposure. So you all know that vitamin D is primarily produced in the skin after exposure to sunlight. Now people who are living in areas where there is limited sunlight, there is longer winters, high latitude, they, or the people who spend most of their time indoors, are at higher risk of developing vitamin D deficiency. Skin tone, suppose if the person is having a darker skin, who having increased melanin, then the skin's ability to produce vitamin D is less. People who are residing in the northern latitudes or areas with long winters where sunlight is limited for an extended periods, they might also struggle to get vitamin D naturally from the sun. So all these factors are going to affect. Not only this, if their dietary habits, if they are having very restrictive diets, or they are having more of a plant-based diet, then for them getting vitamin D might be a little less from the food sources. Vitamin D is mainly found in the animal-based food. So who are vegetarians or vegans, they will have to look for fortified sources for getting vitamin D. Also, as we age, there is a decreased vitamin D absorption, hypothyroidism, chronic kidney disease, chronic liver disease, gastrointestinal disorder, inflammatory bowel disease, celiac disease, bariatric surgery, certain medicines like anticonvulsants, antacids, all these can also affect the vitamin D absorption. So all these are the causes for vitamin D deficiency. Air pollution. Suppose if there is so much of pollution in the air that UVB rays may not come at all. So that also will cause deficiency of vitamin. If you are on certain medications, liver failure, kidney failure, nephrotic syndrome, chronic kidney disease, obesity, a person who is obese can have vitamin D deficiency. And when a person has vitamin D low, he is prone to develop obesity. Intestinal malabsorption, all these can lead to vitamin D deficiency. So now how much time we have to get ourselves exposed to vitamin D? So 10 to 30 minutes of sun exposure is sufficient for 3 to 4 times a week to get vitamin D in sufficient quantities. So the best time when we talk in India, this would mean something between 10 a.m. to 3 p.m. During this window, the sun is at its highest point and UVB rays can penetrate the atmosphere more effectively. So this time 10 a.m. to 3 p.m. and exposure up to 10 to 30 minutes 3 to 4 times a week can definitely impact your vitamin D in a positive way. Just the exposure to sunlight is just not important. There are various factors also. See, suppose if the person is dark skinned, then they require slightly more time to be exposed to the sun because melanin blocks the UVB rays. If you are old, you need little more time. Where you are located, your geographic location, there also depending how long are the winters, how much is the sun exposure there, depending on that also the duration of sun exposure varies. Air pollution, if there is pollution, it will prevent the ultraviolet B rays from reaching the ground. So if there is air pollution, you need to expose yourself more. But in general, the rule of thumb is that 15 से 30 मिनट आपको वीकली 3 टू 4 टाइम आपको एक्सपोज करना चाहिए. आपका फेस, आपका आर्म, लेग्स, यू विल हैव टू एक्सपोज इट टू द सन को आपको एक्सपोज करना चाहिए एंड दैट इज सफिशिएंट फॉर मोस्ट ऑफ द इंडिविजुअल्स इन इंडिया. और अगर आपको बहुत डर है, आपको आपका जो स्किन है वो जल जाएगा, तो आपका जो सनस्क्रीन है आप थोड़ा उसको लगा सकते हो फेस पे और अपना बॉडी, अपना हैंड, अपना लेग, ये सभी एक्सपोज कर सकते हो. इट इज ऑलवेज बेटर टू एक्सपोज योर अम्बिलिकल एरिया और योर बैक because your kidneys are located there. So once the sun rays falls there, the active formation of this the active form of vitamin D is taking place. So you should always try to expose that area also. Whenever you are exposing yourself to the sun, see that you wear something very light which can allow the sun rays to pass. You should not be fully covered. Your hands, your legs, your back can be exposed. See, your tummy area, your back can be exposed because there it is the place where the active form of vitamin D is taking place in the kidney. So see that as much as possible your hands are exposed, your legs are exposed, your back, your stomach areas are exposed. If you wear something full sleeved, very dark clothes, etc., then the absorption of sun is not that efficient. So type of clothing is also important. So sunlight is the primary source of vitamin D and it is very crucial for your bone health and overall well-being. The ideal time would be from 10 a.m. to 3 p.m. So this is the time when your UVB is not that intense and it will make efficient time for this vitamin D production. The duration of exposure varies from individual to individual, the skin tone, your geographical location, your age, etc. is beneficial, prolonged exposure can be harmful. So in such cases, sunscreen can reduce the vitamin D production. So it is recommended that you get some sun exposure without sunscreen for a short period of time before applying it. Okay, so before you want to apply sunscreen, if you feel that your skin is very sensitive, etc., then you expose yourself for a shorter period of time. And diets, you can also include foods which are rich in vitamin D to increase your vitamin D in your diet. And be mindful of the UV index and avoid prolonged sun exposure, particularly during the peak hours, so that the sunburn, the skin damage are prevented.